mind, you can improve it by that way. So what I'm giving you is good enough, really. So you don't have any activity today, you finish, and then you need to go and then prepare for your exam. Anyhow, maybe it may take about 1 hour on this lecture. So be patient and follow me, please. Here, hypersensitivity reaction and disorder, we call it. Well, but through hypersensitivity reaction, what disorders are we going to expect? What do we see? That is very important on this topic. You see, it is on chapter 23, on 10th edition, you will find it hypersensitivity. On 11th edition, now you can get it 24. So that's why I'm giving you the chapters. If you have books, you may read that part. So look now, what does it mean, hypersensitivity? There are different meanings exist, but I am taking one meaning, which is says an inflammatory response to any antigen initiated to produce adaptive immunity or specific immune system. That's all what we say. Antigens, if they exogenous or endogenous, from the inside or from the outside. They come, if they are antigens, fraction of microorganism and infecting agents enter to your body, trigger certain antibodies, especially dominantly immunoglobulin E. Okay, so those ones we will touch today on our topic. Well, look now, usually it refers to as this hypersensitivity. My system says I am going to be out, but I'm on. Look now here. Usually refers to an overreaction of immune system. We know it. That reaction can bring damaging or uncomfortability or occasionally death, fatality. So for this reason, hypersensitivity, it is not easy, really. It is dangerous. We will touch in that one. There are about 4 types of hypersensitivity. I'm not going to mention each of them, really. So I will give you information on those areas, how you are going to differentiate them. As general view, if you have it, it's good, really. If you don't go very specific in it, it doesn't matter. So have an idea only on this content. 4 types of hypersensitivity exist. Some of them, they are attached to B cells and then they form immunoglobulin. It dominantly immunoglobulin E. And then there are also cell-mediated immune system exist, or mediated system we call it, by mediated lymphocytes. What's happened in two on hypersensitivity? We will see those ones. For example, if you are going to transplant heart or kidney from one person to another, then that transplantation is going to reject that organ because the organ of somebody is going to be a foreign body. It is like an antigen, you see. So it neglected using to that body. So if it neglects, what will you do? There are certain hormonal background, anti-lymphocyte, and then prednisone, cyclosporin from fungal origin, which are made against resisting those rejection. So those ones we are going to touch in detail. So what do you need to understand first is there any formation of B lymphocytes or immunoglobulin? Dominantly immunoglobulin E, or the other one, how they are going to reject it. Then we discuss on cell-mediated immune system, the macrophage, how they are going to work, helper cells, cytotoxic cells, suppressor cells, how they work together and then join with humoral immune system B cells to produce immunoglobulin. So that one we are going to see it on this following figure. Look now here. It's very interesting. Now, when we say immune stimulation, this stimulation, hypersensitivity, it is not easy thing, you see. You can get it before coming to this environment, and then you inherit from mama because of genetic deformities, which you inherit. So these genetic deformities are giving sensitivity. And then after you are born also, by exercising and then by food, taking food and then certain kind of products when you are using, you are going to have allergy. And those ones we are going to divide into 2 categories. Immune production, immunoglobulin E, and then the ones which they don't show immunoglobulin, just rejected. Kidney, somebody's rejected without any immunoglobulin. You see now, heart replacement, no, rejected without any immunoglobulin. Okay, now, if we are going to have certain earrings, if you are going to use, it causes dermatitis, local inflammation, it doesn't form antibodies. It is cell-mediated immune system. That's why we are going to say this hypersensitivity, the production of immunoglobulin and non-immunoglobulin, we are dividing into two categories. Look now, the ones which are with a T lymphocyte or cell-mediated immune system, which are not going to produce antibody, you are going to see them. Look now here, you are having heart replacement and then earrings and then certain dermatitis case. Okay, now, for example, if you are going to be infected or if some kind of IV touch your skin, you are going to find dermatitis or some irritation. Say formalin, certain chemicals you touch and then you have local irritation. Those ones cell-mediated immune system, they don't produce antibody. Production of antibody, it takes time, you see. That's why it is very important. Production of antibody, immunoglobulin, the process takes time. It doesn't come immediately. Immediately coming one are cell-mediated immune system. Very important, you see. So those ones we are going to touch. Look now. Here, for example, if you are having food allergy, B lymphocytes. Are you going to get immunoglobulin? Yes. If you are coming to the laboratory as dog and cat to our laboratory, we have 35 chemicals. We are matching your blood, and then we can identify for what you are allergic. Okay, that's good, you see. Antibody, you have it. Antigen are the products which we are using. We have kept in laboratory with your serum is from your blood, making join together antigen, antibody, we will get it. Precipitation, agglutination, whatsoever. You see, so for this reason, antibodies formation, it takes time, but it's very important on diagnostic value, really. It's very beautiful. When you are having, for example, respiratory allergy from hay fever or asthmatic case, you can inherit from mom and dad. You see, genetically, diabetic case, yes, you can inherit also. It doesn't mean you are 4 and the dad has diabetic case and then 4 of you are going to be positive for diabetes. No, there is sensitiveness and then your body building structure is different. So for this reason, 1 person out of 4 maybe represent like a dad. You see, the others maybe on the next generation. The ones that didn't show on their dad, but on their grandchildren, it may show also. That is called genetic deformities. And then that is sensitiveness. Hypersensitivity, when we are saying it is just stimulating for certain antigens, sensitiveness, increase. For example, somebody insult you, you want to beat him. That is sensitivity. Oh, you ignore and then go? It's something, you see. See, you need to have sensitivity. It is a nerve impulse. You are going to get it. So your body is representing. So here, homeostasis is not kept well. So for this reason, if there is any pathology exists, that pathology is in a short time showing certain immunoglobulin. Yes, it is going to be with humoral immune system. And then it is going to show you immunoglobulin E. Okay, why immunoglobulin is going to trigger on people who are taking certain food and whatsoever, and then we show immunoglobulin A. Aha, I will give you some meaning for that. Why? Everybody is not allergic for certain things. In the same family, as I told you, there are certain people who are having immunoglobulin A lymphocytes, and then they are resisting to show immunoglobulin E. Haha, look at that science is. If you have less immunoglobulin A, then you are going to represent immunoglobulin E, allergic reaction. And then your sensitiveness is high. I'll bring you that one also in the future slides also. You will see, it's very beautiful, you see. When you are allergic means you have some deficiency already. You inherit it genetically or after you born. You know there are certain allergic reaction exist. Also you create allergy. You exercise. After you eat, you exercise. That exercise is giving you hard time, you see. And for example, you are hungry for a long time. And then after being long time hungry, and then when you eat, you are going to increase white blood cells. We call physiological leukocytosis, not pathological. Physiological leukocytosis. You work very hard work, and then you have physiological leukocytosis. And then you didn't eat for a long time, you are going to create physiological leukocytosis. Just means your body is going to be sensitive for something, you see. So for that reason, what you need to do when you are hungry, you need to eat a small amount of food in the beginning, and then step by step you need to take the food as it is going to be comfortable for you. Too much food you eat, you are bloating, you can't care, because that is almost some kind of tympani which is going to create with similar to this allergic reaction, some kind of sensitiveness increases, you see. So those are similar. For example, when you are taking blood, if you are going to take blood, yes, we are going to differentiate that one. That is type 2 hypersensitivity, we call it. Is there certain immunoglobulin group you can get? Yes. Okay. What about this one? If you have arthritis case, yes. Arthritis case, can you identify? Yes. If you are having it, it is long process. You are going to see this kind of result. It's not very simple time. If it is simple hours, and then today and then tomorrow morning you get something, yes, it is cell-mediated immune system, you see. So you are going to get certain medication show allergy locally. It doesn't trigger immunoglobulin. It is cell-mediated immune system. It is Warfield is showing, oh, we have inflammatory process now. Can we be ready? That all is coming with hypersensitivity. That's very interesting. We will touch some more. Look now, you are having certain pollen. You see, when the plants are flowering, when the rain comes, and then when the flowers are increasing in the environment, many people, asthmatic people, are going to suffer. You see, so many pollen in the air. So you get it by respiration. Okay, that is respiratory allergy, we call it. Atopic disorder, we call it. This is, you are going to get them in somehow, and then trigger on hypersensitivity, you see. So for this reason, for example, there are certain drugs exist. For example, allergic to penicillin. I can't. When I take penicillin, I need to take Benadryl together. Is it working? Yes, it will work. You see, when I go third world country like Ethiopia, we don't make medication, you don't find it. If I have something, a problem, I can take penicillin, and then I need to have Benadryl together. It works? Yes, it works. So we do it, you see. So this is how we are going to resist, and then somehow also how it is going to show allergic reaction. For example, I don't take any Benadryl and then take penicillin, and then you are going to see all my finger between, and then all my hands are scratching, my neck, my chest, everything is scratched, and then irritation, you see, burning sensation. So this means some drugs are increasing, triggering hypersensitivity. Okay, we will touch more. And then when you are taking household dusts, for example, if you are having carpet today, in many houses you don't find carpet. Mostly it is wood. Now it is good, you see, it's good. I have a brother in Detroit, what you call Connecticut. He has allergy, for example. He doesn't use carpet in his house. Remove carpet, and he is now fine. 3 years. He doesn't face any allergy. You have dogs. Dogs may show allergy. Okay, cats may show allergy, and then you are allergic to the hormones which the dogs produce, or the mice produce, and then the cats produce. So what you need to do, if you are allergic to dogs, the source must be avoided. You need to remove the dog, you need to bring the cat. If you are allergic to the cat, then you need to get birds or other animals which you are not going to be allergic if you like animals. You see, you need to remove the source which is going to trigger hypersensitivity. That is the only means you have it. The only means, because hypersensitivity, you don't treat it. There is no treatment for hypersensitivity. For example, when I'm taking penicillin and then Benadryl, it is not, I'm not being treated with Benadryl or something. I am just protecting it. I'm protecting it, you see. That protection, it never stops. One day I am going to be sick again, you see. So for this reason, when we are saying hypersensitivity cases, when we want to control it, we need to avoid the source. The source, etiology, must be avoided. Okay, now you are going to have some molds, yes, rainy season, around the windows, around the bathrooms. You are going to see, yeah, this greenish appearings. Those are mostly they like pH low, where there's sugar, and then pH 5 and 6 area they want to grow. So you need to make it, you need to destroy it. You can destroy them with bleach, no problem. When you are taking baths, if your bath is dirty and then greenish, you find it, they can trigger allergy. But what you need to do is take a bleach, sprinkle it, you see, 1 to 10, 1 ml bleach, and then 10 ml water, mix it together and spray it in the bathroom. And then you can destroy the fungus. You see, so for molds you can destroy. That is how we are going to destroy the etiology, the source. We need to destroy it. So chemical fumigations, yeah, gases, yeah. For example, there are certain people that don't like any gas smell. For example, I don't like the gas smell itself. It's sulfide smell, and then it looks like a fart when you are going to smell it. It's not good one, so you hate it. If you are going to stay, then it may be triggering some kind of reaction. Indoor air pollution, we said that about perfumes. Yeah, there are certain people like perfume, and then the certain perfume for someone they are very good, somebody not. You see, somebody not. So I know that one also. So perfume's good, yes, good. But if you don't like it, then change another perfume. Okay, animals we said already, and then the food, yes, the food. For example, I like peanut butter. Most of you like peanut butter. Do you know that we don't give for children 2 years and less peanut butter? You are going to destroy them. You don't see it immediately, but they are very dangerous. Okay, if you don't believe me, go and then Google around about peanuts for the children less than 2 years. It's not good. You see, it's not. So you need to stop. If you are going to give hurry and then you don't have anything to do to make them play or don't disturb them, you give that one and then move. No, it's not good. Peanuts, not good for the children. You don't. So Google around and then find it more. What I said is right or not. So peanut is not good. For example, I told you before also, the eggs are not good. Eggs, you know, from 4 eggs, 1 egg is contaminated with virus. There is virus in it. Okay, because we boil it and then eat it, it's okay. You see, but if you don't boil it, 1 out of 4 eggs are virus carrier, 1, and then there are mercury carriers. You fish, milk, soya milk itself, and then peanuts, they are carrying certain chemicals. They are going to trigger allergy in your body system. So look now. So for this reason, think about, shop around, especially our sisters, when you are coming pregnant, you need to be careful with egg and then fish products, especially late pregnancies. You need to. So those are mercury carriers. Mercury is heavy metal. It's dangerous. It feeds on the nervous system too. So for this reason, think about that it may not trigger on you. And those are, for example, the stinging of insects. You know, those ones, yeah, there are some kind of black African bees, we call them. And then they are imported to America somehow, and then they are destroying American bees, normal one, which are going to produce honey. Those black ones are very dangerous one, and then feed with the other bees. Look now, you know that if there are 50 bees bite you, you will die. It is lethal dose. It is 50 bees biting you. You see, their dose can kill you. But if it is less, it's good. For example, certain countries are using the bees toxin, what they produce on their probus, and then that one is helpful for a person to be treated from rheumatism. This is being practiced in Russia and Poland. You see, rheumatism treatment with bees. They are going to take you about 15-20 bees where you have this rheumatism case, they put on you and then they will die. You know why they die? Because their brain nervous system is attached intestinal system. Once they send their probus, they are going to kill you too. They are going to give you some toxin in you, and then they are going to die also. After that, they don't. If the bee, any bee bites you, it doesn't live. No more. It goes off. When it bites you, gone. For this reason, people are using this the probus of those bees to treat rheumatism case. So look at how science is going advanced in certain area. So look now, we say allergy, 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 and then we are coming for certain allergies also. Look now, here, swollen lips, abdominal cramps, nausea, diarrhea, hives, irritation of the skin, anaphylaxis. Oh, that anaphylaxis, I will give you some information on that. Fish and then shellfish, eggs, wheat, even the bread which you are eating is having certain kind of allergen. Look now, soya, peanuts. Imagine, these all are having certain allergens, which are going to trigger allergy that cause hypersensitivity. Now look here now, systematic anaphylaxis. That is what I am going to show you. That is a clinical symptom. That is one of a disorder through hypersensitivity. What body? They are going to increase the capillary system, the blood capillaries. When the blood capillaries are increasing, the fluid is coming from the blood vessels to the extracellular compartment. That means you are having certain blood pressure, edema, and then hives, irritation can occur. You see, so it is going extracellular compartment. Is there anything left in the blood vessel? Yes, but it is not enough. That's why it is triggering blood pressure. Look now. And the other thing which is very important is when certain anaphylaxis case, the lungs, you see, the blood vessels, yes, they contract. Okay, they come narrow. That is one way. And then the other one is bronchial muscles are going to be squeezed down. So they are shortened. When they are shortening, you see now, the air cannot flow in. Because the air is not flowing in, you see, instead of oxygen to be present in your airway, then carbon dioxide is going to increase. Since carbon dioxide is going to increase in your airway, then it is going to show you anaphylaxis. Means you are going to die within 10 to 15 minutes. Look now how allergy is. If it is going to create an allergic shock, then you are going to die within 10 to 15 minutes. Why? You don't have oxygen. Red blood cells cannot be supplied in your body system. Okay, now, so what? You are going to be anemic. The blood cannot distribute in your body system. So you will be in a shock. So you will die within 10 to 15 minutes, you see. So that's why, you see, this we say deoxygenated blood, when it is coming through superior and inferior vena cava, come to the lung through the pulmonary trunk. When it drops to the lung, it is going to release carbon dioxide, and then oxygen will come in through alveolar sacs, and it can distribute in the body system. Look now. So for this reason, if the lung is not going to work, then the carbon dioxide is circling. So when the carbon dioxide is circling, oxygen is not there, then you are going to die within 10-15 minutes with anaphylactic shock. You see, it's very interesting. This is hypersensitivity, we call it. Very interesting topic, really. Now look here now. Asthmatic case is one of them, you see, which we are saying hypersensitivity. Now, through asthmatic case, these airways are going to be narrow. In this one, normal. In this one, it is going to be narrow. Why? Bronchoconstriction, they are going to squeeze down. And then blood vessels are going to dilate. When they dilate, they are going to let the fluid out of the blood vessels to extracellular compartment. Okay, now, so vessels are going to dry up like a spring. There isn't any water in it, in that spring, you see. Now mucus is going to build up also. Mucus is making there, it's cooked up, and then you are not going to get enough air. Instead of getting fresh air, you are going to be like you are in a water. You don't get air enough. So that means it is going to make a cooked type of a mucus, which is going to hold all cilia, which are going to move and then exchange the air around respiratory tract, and then that is going to be cooked, and then you can't. That's why you are going to cough also. Sometimes when you are having some kind of flu type or some kind of cold, you are going to You cough. Why you cough? Because those cilia are having certain couples of liquid or mucus, they hold it. So you are coughing to release it, you see. Let the cilia can be little bit humidified, but not going to be make like wet enough, and then the air cannot pass it. So if it is wet enough, air cannot pass it smoothly, it is pulp making mucus build up, you see. So for this reason, asthmatic case, that is what you can expect on, that is part of hypersensitivity. Looking at this one, for example, normal case, this is little pathologic, and then this is very narrow. This constriction of the airways are here, you see. It is very narrow, you can't get enough air. Okay, when you are coming, this one is normal, look pathological, and then mucus is built up. So how can you respire? You are going to touch your chest like you are supporting. That's all what you can do. Pathology. And then when you are coming this one, look now, the air which I said in this alveolar sacs, which are going to exchange oxygen and carbon dioxide, or oxygen carrying and oxygen coming, and then carbon dioxide carrying blood, deoxygenated blood, which we are going to say less oxygen in it. You see, less oxygen in it. When we say that type, when it comes to the lung, it is going to get more oxygen, carbon dioxide is going to be released. You see, that is a way which you are normally exchange. Now, oxygen coming, carbon dioxide is leaving. So in this one, no, look, no, it is blocked. So what will happen? Antihistamine, certain drugs you are going to take for this one. Okay, now you are going to have certain things now. When we are saying allergy, always we are going to think all people are having some kind of hypersensitivity. I don't think so. Not all. You see, how we are, how we came to this environment makes a difference, really. If mama or daddy gave you genetically malfunction or mutated gene, then mutated gene is going to show in you. Maybe that it may not show your children, grandchildren. But mutated gene can be inherited. That we call it the primary deficiency, we call primary deficiency, which we inherited. We offsprings from parents we inherit, malfunction, mutated one. That mutated gene, look now, it is lack of sufficient immunoglobulin A creating lymphocytes. They are not. So you are going to produce immunoglobulin A. Look now. Why? Because you have deficiency already. How did you get it? Genetically, you see. So don't blame always parents. Also, you can get that one after you are born in the environment. How you are going to work with chemicals. You see, the ones who are going to be pharmacists in the future, the ones who are going to work in coal minings, if you are going to work, because it is paid well. Look now, those ones are going to give you certain allergies, really. You see. Now, look here, very interesting thing is, go and then sit when you are driving your car, left and then right, in freeways especially, sit. And then you can see some trees are just brownish, and then burn up you can see. What is it going to burn? Chemicals. Which chemicals? Carbon monoxide, which is coming from your car. You see, non-burned up air is coming from your car exhaust, and then it is burning the trees in left and right. Look now, it is changing, isn't it? What about you? You are getting also. You drive on a freeway more than 15 years, you are having certain kind of change in your body, especially your lung. Your lung is not going to be clean. It is going to have some darkish spots on it. From where? From the asphalt. When you are driving the hot sun, and then when you are driving on the freeway, you are getting that air. That air is bringing you certain chemicals. Those chemicals which you are getting, they are artifacts left from oil filtering. Oil from our cars, from what? So for this reason, look now, we are getting everyday chemicals. When you are living in a big cities, in industrial city area, you are getting chemicals, always. Do you know that many people around the Los Angeles city, around the downtown area, they are more positive for asthmatic case than people who are living in periphery or out of the cities. Why? Because they are getting chemicals. Look, cemental factories, certain plastic factories, they are going to release digoxin. These digoxin type of chemicals are not good for yourself. And then they are cancerogen, you see, if they are increasing in number. So chemicals, look now. Even without going any chemicals, when you are working in pharmacy or production of pharmaceutical drugs, you don't stay long time to work with that. Maybe 15. In Russia, for example, if you are working in certain factory of medicine, you cannot work more than 15 years. After that, you are going to retire. In America, I don't know. 15 years only in Russia. Why? Because those chemicals are going to harm them. Look now. So look at here, what you are going to see when you are driving on those freeways, you are driving on a dusty areas, when you are going to do those kind of activities, your lung is also being cooked somehow. Can you avoid it? No, you don't. Because you want to live, you want to survive. You need to get air. So for this reason, you are going to face it. Anyhow, what will you do? You need to live. So now this is all increasing hypersensitivity. Look at it. So the lungs, for example, charcoal miners, lung, if you are going to do it biopsy and whatsoever you see it, their lung is like a charcoal. Yep. It is not flexible like yours. And then lung and then spleen are one of the fragile organs in our body system too. Look now. So for this reason, think about how our futurity is. Why you are going to die shortly? Why you don't long time? Why don't you live long time? That is chemicals. Radicals staying in your body. Yesterday you ate salt. Before yesterday you ate salt. From your childhood you were eating salt. Salt is leaving certain radicals. Salt is made up of sodium and chlorine. Sodium is a metal. Some radicals are left. So you are going to be suffocated by chemicals in the future. You are going to die from that. So your mechanism of defense is going to be lower and lower when you are reaching 65 and 70s. Why? Because you have so many accumulation of radicals. They are chemicals, you see. So these are going to be like cell-mediated immune system, you see. Those organs are not going to function very well, you see. Those are things which you are going to think. Look now here, very interesting. For example, there are certain hospitals and whatsoever, they are going to pass certain serum to another person. And then that is going to cause serum sickness. Why serum sickness? Because certain medications are having certain proteins. So when you are passing antibodies, you are passing proteins to someone also with those meds. And then they are triggering hypersensitivity. Aha, that is one. And then the other one, for example, any serum, we in veterinary medicine, we use it also. You take serum, blood, and then centrifuge it, and then the serum you took, and then pass it to another person or to another animal. That animal cannot be sick for a certain period, not a long time, certain period. It is very short time protection system because those antibodies, they don't duplicate in your body system. They don't duplicate, you see. They are going to live short life there. For example, red blood cells, you know, they are going to live 120 to 140 days. Okay, 3 to 4 months it means. So certain antibodies for protection system, they are going to stay shorter time. So when we are transfusing a person from one person serum to another, certain antibodies which are there, they are going to be allergic to someone. For example, in horses, for example, we have 14 type of immunoglobulin group. In dogs, we are having 7 immunoglobulin groups. They are not like human, 5 immunoglobulin group, you see. When even we are transfusing serum or blood even, we don't have big problem in animal if we are going to do first time, you see. If you are going to pass plasma for the first time, yes, it's okay in human. Serum is okay. But if you are going to repeat, then you are going to make matching, you see. So why? You see, because we are bringing certain antibodies and then passing to another person. Those antibodies are maybe carrying certain kind of proteins from some microorganism, and then step by step they are going to be poisonous to you, you see. So what are you going to do? You want to avoid it? No, you want to try it. Look now, this is serum sickness, we call it. The irritation of the skin, You see, like erythematosis or some kind of irritation, itchy type. And then you are going to see another one. Look, you are going to see the skin, how it is going to change. So that is transfusion. Transfusion of certain serum, which is containing certain drugs, and then passing to another person. So you need to verify that person, what kind of drug was he getting, antibiotic or any kind of drug, antimicrobial agents. What kind that person is getting in a short time period. That's why it is very important to declare that one. So this irritation or serum sickness, we call it clinicals. For example, contact dermatitis. It is not going to produce immunoglobulin. You see now, this is hives, and then when you are going to touch them, they are going to make a rash on your skin. And then there are a chemical, we call it urushiol. Urushiol, it causes erythema or like eczema on the skin area. This happen. This is hypersensitivity. Okay. So those are things which we need to understand it when we are going to work with certain biological products whatsoever. Autoimmune disorders. Autoimmune disorders, we say it is coming first with genetical mutation, gene mutation from mom's side or dad's side, or mom's dad or dad's dad side, or the mommy's mom or dad's mom side. Okay, it passes. It doesn't show for dad, but grandchildren may see it. That is genetic mutation. See, that is going to be DNA. And then also the diet which you are eating. If you are going to protect yourself with balanced diet, there could be a kind of change exist. But if you are a weakened system, you don't have enough, then we are having genetical mutation, and then cells can die by themselves. We call it apoptosis. It is a process of programmed cell death that occurs in multicellular organisms like we are. You see, parasites are multicellular, we are, except prokaryotes, we are multicellular, you see. An antigen can mimic a body substance, causing immune system to attack self-substances. That we call autoimmune disorder. That's why there is no treatment for autoimmune disorders. No. What is there? Protection, prevention system only. That's all which you are having. Treatment usually involves suppressing the immune system. That's all. You are going to vaccinate whatsoever, to protect it whatsoever. That's not. For example, mesenteric gravis. This is 10 girls and then 3 boys are going to have mesenteric gravis. This is this muscle of the cheek, and then the eye are going to be weakened. Even the lips are going to be weakened, especially masseter muscle. You remember when you were studying about anatomy, sternocleidomastoid muscle, that is from sternum, it touch clavicle, and then it goes to masseter muscle. Those masseter muscle means we are saying a cheek muscles. Those muscles are going to be attacked with mesenteric gravis. And then mostly our beautiful sisters are going to be attacked with this one. 7 of them, and then 3 boys, you see. So this is, can you treat this one? No, you can't. There is no treatment for that. It is weakness or fatigue of the muscle. Okay, now, what about, I'm going to show you the clinics, how it looks like. Diabetic case. Diabetic case, can you treat? Yes. Can you completely avoid? No, you can't. Until you go to that box, until you are buried or burn up your body to ash, it goes up. It doesn't. Unless you create in the future. Maybe in your life, you create some kind of medication to treat diabetic case, well, it's good, you see. So it is hypersensitivity. One, you find it, almost we think that you got one, and then you have got for all, you see. It doesn't. You see, it doesn't. Mesenteric gravis, you don't treat it. You don't avoid it. And then if you are using tetany, Clostridium tetany, tetanus toxin, if you are going to use, maybe temporary you may try to improve. But that is turkey neck or whatsoever, you become older and then stretching your muscle, yes, it can work. Or your skin, it will work. Or especially on the muscle. Yes, it increases the tonicity of the muscle. This is tetanus. So tetanus toxin. So in diabetic case, I don't think so. You see. So that's why a lack of insulin production result starved for glucose energy. That means beta cells are in pancreas, they are not going to be produced. That's a problem. Result in blindness, kidney failure, and then other complication with type 1 diabetic. That is hypersensitivity type also. No medication. Look now here. Here you are going to have, look, the eye. Mhm. Mesenteric gravis. And the weak eye. And then I will bring you another one here. Look at this. This is weaker eye. Eyes weak. And then look, the lip are weaker. So that is mesenteric gravis. You have seen today, you are going to find in the market or wherever you go, you can see people. You need to sorrow for them, you see. No treatment for that. You die with it. Okay, now, transplantation. This transplantation of the heart and kidney is now, very now, you see. And then now today, for example, if your arm is broken, if somebody died, and then they are going to take that arm from that dead body, and then they are making transplantation or something like a grafting. They are doing it. It works. It's good. The science developed. It is recent, maybe 10 years on that process. It's working now. You see, if you have short leg, somebody there died, and then his body can be replaced, and then it is going to have functionally working. At least it is something is better than nothing. It can help you. You see, that is transplantation. Especially in transplantation, we are going to understand only two words. There are many of them. Autograft is you are taking from, for example, those cleft having people, you are going to take from buttock muscle, and then you are grafting it around the mouth area to close the cleft. That is autograft, you see. And then isograft, when we say identical twins, you are going to take from one and then you are passing it. There are so many grafting ways exist, but I didn't mention on this one. So when we are talking about transplantation, I am going to bring you another one. Before I go there also, primary immunodeficiency and secondary immunodeficiency. You know it by this word. Primary immunodeficiency, which result genetic abnormality we get from our parents. Secondly, we are responsible for it. After we are born, it is acquired in our late life. You see, those are called primary and then secondary. Okay, now that is all when allergy comes and then we pass it. Look now here. I know from my class, from you, about 10 to 12 students, 12% of the student can pass the class without teacher. They can read online, they can do something, they can make a good grade to pass the classes, really. But this virtual system, and then you are coming and then following us. There are certain, you Americans are very delighted, really. You have internet system, you have books, you have free books exist online. Do you think in other countries like my country, is there that kind of opportunity? No, no, you don't. You are educating yourself here now on this way, virtual way, but here in my country, beginning March, it is closed. No educational, no training system. Look now, how we are lucky here. At least we are teaching you at home, you see, sitting in the virtual system or online system we teach you. That's good, you see. We are lucky being in America and industrialized country. So that's very beautiful. If you are missing something, go and then read. Let me go on these drugs. These are very important ones, especially nurses, and then who are going to be doctors and PAs. This is a very beautiful one. And then I will mention some of them. So I will give you some information, which is good enough, really, that you can understand chapter 4 about bacterial structure, especially. Now here, we say antimicrobial drugs, we call them. Okay, now you know Alexander Fleming, the first person, scientist, who produced the first antibiotic. That is penicillin. And then its origin is from fungus, from mold, you see now. And then that was produced and then practiced among the military. Wounded military were treated with penicillin. And then after that, it was distributed in the market, you see. So for this reason, the first antibiotic, penicillin, don't forget it. So now look, the fungus, how it looks like, penicillinum. And then we call penicillinum notatum. That is the first one practiced. This one, look at how it grows on the media. But the media which it grows is different. Tryptose agar, and then we call it nutrient agar, blood agar are different. In this one, we call sabromedia. Why sabromedia? Because it needs sugar. A sugar containing media it needs. That's why we are preparing it, you see. So for this reason, in sabromedia, it looks like this kind of colony. If you are taking cotton blue chemical, and then by that, if you are going to stain it, you are going to see the fungus hyphae like this. These are hyphae, and then sporangium at the top. Hyphae, sporangium, and then here it is mixed up. It is mixed up here. But in this one, look now, here it is hyphae, now sporangium. It's going to produce another babies. So this is how we call penicillinum. And then we produce penicillin from it. You know it, how it is was produced, and then the scientist, when he works with this one, how he produced it, I'm not going to mention it now. Just I'll pass with this one. Look now, he's this antimicrobial agent we divide into 3 categories. Now you are going to learn something. You know it, but I'm going to add you something. Really, it's very beautiful. What? Aha! Now we classify antimicrobial agent in 3 categories. Now, look now, synthetic ones, antibiotics, and then semi-synthetic. Look now, from today on, when you are going to talk about the drugs, you are not saying antibiotics. Why? Because you don't know from what origin it is made. You need to know that drug is antibiotic if it is made or derivative from living things. Otherwise, you don't call it antibiotic. So collective name is the drug, you see, or antimicrobial agent. That is the only right way. You become a doctor, you PA, a nurse, don't say antibiotic if you don't know it. Now you are going to say it, antimicrobial agents, or you can say drugs or meds, like that. You need to say it. So you now today you know some of them are made synthetic from plant origin. We are having a formula, and then by that formula we can extract from the plants. Okay, from chemicals we can make it. So we can make it from that origin. If it is from chemical, synthetic, we call it. From plant origin, from living things, we are saying antibiotic. Okay, now when we are using the combination of synthetic and then antibiotic, we call semi-synthetic. Aha, that's finished. And then these meds, we are going to divide them in 2 categories. If they are synthetic, antibiotic, or semi-synthetic, in 2 categories. Which one? Broad spectrum and narrow spectrum antibiotics. Or when we come to the drug, we are saying broad spectrum drug, and then, or broad spectrum meds, and then narrow spectrum meds, we call them. Why? That is how you are a specialist, how you are knowledgeable person when you are practicing those kind of terminologies. Why? If you are going to go to the hospital and then the doctor says, I'm going to write you antibiotic, means he knows it, the antibiotic he is going to prescribe you. If he is saying, oh, I'm going to provide you some kind of meds, then that person is collectively using that terminology, you see. So people normally, they say, oh, antibiotic. Every medication is antibiotic. It's not. You know it from this topic. Not. Antibiotics are only from living thing origin, from bacterial origin, from fungal origin. Penicillin is antibiotic, you see now. Erythromycin, from erythrocytes. It is antibiotic, you see. So for this reason, think about when you are going to use those ones. Synthetic, antibiotic, and then semi-synthetic. Remember those ones. Now, broad spectrum and narrow spectrum. When I say broad, means they are going to serve to kill more microorganisms. If there is Listeria, if there is Salmonella, there is anthrax, one med, if you are going to use it and then kill, oh, that's a broad spectrum drug or medicine. Okay, now, if it is going to serve only one mycobacterium, for example, we are going to use tetracycline or streptomycin. Mostly known is streptomycin. Streptomycin for against mycobacterium. Okay, now that is going to kill it. Isoniazid, it can kill mycobacterium, you see. Why? Because Mycobacterium has waxy structure. Many drugs, they don't kill tuberculosis. That's why you are going to be treated 6 months if you are positive for TB. You see. So the covering, the waxy structure is resisting those drugs not to kill that microorganism. You see now. So for this reason, we are going to use one drug, and then that we are going to say selective. It is narrow spectrum drug. If it is antibiotic, we say that also narrow spectrum antibiotic. And then the other, maybe broad spectrum antibiotic. You see, so those kind of terminology now. Selective toxicity. Selective toxicity, it is only toxic to the pathogen, infecting agent. It is not going to be pathogenic to the host cell. Okay, put question mark. Toxic dose is going to harm the host cell and then killing at the same time microorganism. Therapeutic dose, it is not damaging the host cell, but it is killing the microorganism. Look now, this is vague theories. I'm teaching this one because it is written. But microbiology point of view, if we are going to see, any meds which you are going to get them, they are toxic to your body. I'm telling you, any, but minimum toxic. How do I know? Anything which is going to enter to your body, I don't know about water, anything enter into your body, even the food is toxic to your body in somehow. How? Look now, you are going to eat some dry food or medium-sized food, and then when you are rotating that food by production of those three saliva type, sublingual, submandibular, parotid gland, when they produce saliva and then breaking down carbohydrates, that your mouth is oral cavity, and then it is going to circulate the food until it dissolves. At that moment, that food is eroding your epithelial tissue from your mouth. Look now, you are safe because epithelial tissue can regenerate shortly. That's why you are surviving. Look now, you are taking from your mouth up to your anus. Any reaction, for example, gastric juice area. If you are taking, for example, if you are taking hydrochloric acid, 2%, 2 pH is in your stomach. It is like your car battery fluid. Look now. So it stays in your body. It is going to burn it up. You see, burn it up. That's why if you don't eat about 12 hours, your stomach is bubbling and then giving you a sound. So give me to neutralize it, it says. Otherwise, I'll continue harming your stomach, it says. So that's why you are going to eat or you drink water to neutralize it. Because there is sodium chloride, if you are going to take it, and then hydrochloric acid there. Sodium hydroxide, if you are going to take it, that is bleach type. But it is going to alkaline. That alkaline is mixing with acidity in your stomach. It is producing salt and water. It is neutralizing, and then your stomach is in a safe condition. Now, look now. Roche-like structure of your stomach is working always, always until you die. Works, works, works. Imagine. It is going to be flat like 405 freeway one day. That means we are losing the epithelial cells. Those muscles, when they work, their energy reducing. Unless you give good energy, and then ATP can be produced. Look now here, very interesting. Everything which we are taking to our body, even the clothes which you are wearing, it is going to erode your skin. Yeah, wear it one clothes, wait about 50 minutes, and then put it one place, and then smell it another time. You smell it, you see. Look now, and then take your shoes, put it your shoes, and then look your foot pads, how it is soft. Because of the shoes. The shoes itself, the socks which you are using, they are going to erode your epithelial tissue from your pads. Look now, even those socks which are going to protect you, your shoes protect you. The clothes, for example, if you are hairy knees area, or this tibia fibula area, if there is hair and then you are wearing pants, it is eroding that hair, you see. Look now, one side there is hair, in the other side no. Why? The pants are eroding it, you see. Everything we do, it has side effect. There is some action exists. So 60% of drugs which are prescribed by the doctors is false one. It is not really matching for that kind of disease, you see. So if you are going to think that 60% prescription is wrong, then imagine what are you taking now? What are you taking? Any medication which you are going to take, when they are going to kill microorganisms, please understand me this one perfectly. Microorganisms are having cell wall. Okay? Gram negative, gram positive bacteria. They are having cell wall. Those our cells in our body system, they don't have cell wall. And then when you are taking certain medication, when it is killing the bacteria, how it doesn't touch your cells which do not have a cell wall? Imagine. Bring it. Give me a proof. That's wrong. The theory says never touch and then it is safe. No, it's not. Selective toxicity. It doesn't work that theory. It is not. Only microorganism it kill, it doesn't host the system. No, but we are comparing the danger how or the advantage which it gives. That's why we are saying like that. Otherwise, the theory is wrong. Selective toxicity, really. It's not. You eat food, for example, too much it causes tympania. Okay, why? And then you didn't eat food. And then you eat at night after 12 hours, you eat food, and then you are having physiological leukocytosis, increase of white blood cells. White blood cells increase its pathology. Okay, now, when you work, hard work, whole day, and then you are having physiological leukocytosis instead of pathological, physiological leukocytosis, increase of white blood cells. When you eat too much food, now the food is going to be stretched around tympanic area, and then you are having physiological leukocytosis, increase of white blood cells. Increase of white blood cells are going to consume red blood cells. Red blood cells cannot carry oxygen, then you are having yawning whatsoever. Look now. So for this reason, there is side effect always. I'm telling you. Don't think that it is a perfect theory when we are saying. So understand it. This theory, selective toxicity, there is side effect always. For example, I'm talking now. Look now. If I talk 1.5 an hour, after I talk, unless I eat something or I drink something, I'll be a little bit yawning. I'm going to be tired. My throat is going to be a little irritated because I'm talking. It's a side. Do you say because I talk it there isn't no any side effect? Yes, there is. My larynx is how many times being open? How many times? 1,000 times it is opening to give this kind of sound. Do you think it is not working? It's working. So it is irritated, you see. That's why I'm spending my energy too. It's because I'm talking, I'm spending energy. When you are going to produce energy, you are going to accumulate more mitochondria to talk. That you cannot be weak enough, you see. So for this reason, there is side effect always. I'm telling you, side effect always there is. Whatsoever you do something beautiful one, there is side effect exists. You see. So for this reason, when we are saying about selective toxicity, remember bacterial cell wall structure, your host system, our cells, they don't have cell wall, which is going to be damaged early. Our host cells, you see. So pharmaceuticals, they don't say there is a danger on that. They don't. Because they want to sell it. But somehow they are going to treat you anyhow, you see. So look now, when you are taking some medication, your cells are going to die. Yeah, they are going to die. Something good is they can be replaced easily. That's why we survive, you see. So therapeutic dose, remember it. It doesn't kill only pathogens, it kills your cell too. So there are different theories exist, but just have an idea. Okay, now we are coming to finish. Look now, here, these are antimicrobial agents, especially for bacteria, we use it. Look now here. For example, we are having broad spectrum, narrow spectrum, I said already. Drugs, it says, it doesn't say antibiotic. Look now, the word is correct one. This table shows very beautiful, really. If you are having it, this one, cut it from your book or copy from your book and then keep it. When I posted this one, I'm going to post for you. When I posted this one, keep it for you maybe. Print it out and then put it, copy this one in Word, print it out and then keep it in your refrigerator. You are going to understand so many things on this one. Look, very interesting thing is broad spectrum and narrow spectrum. If you are having children, especially, you want to keep a dairy, what kind of meds the children are getting is very important. Look here now. Here you are going to have broad spectrum and narrow spectrum drugs. What does it mean? Okay, now, for example, look now. Here, this table itself, it is something missing. Why? I didn't write this one. But logically, at microbiology point of view, this table is not this much good. Why? Look at here how it is going to put. We are having gram positive and gram negative bacteria. Totally. Okay. So Acid-fast exists, but it is also gram-positive bacteria. Now, here look now. When you are going to see, there are mycobacteria. It is gram-positive, but this is acid-fast bacteria by acid-fast. Okay, now we are having chlamydia, gram-negative bacteria. Rickettsia, gram-negative bacteria. Okay, now why don't we put this and this with this one? So maybe the author, when he does this one, he wants to show broad spectrum and the narrow spectrum view. Drugs activity he wants to show. Otherwise, all those ones, mycobacterium, chlamydia, and then rickettsia must be classified as gram-positive or gram-negative bacteria. To find it, well, here now, imagine. Let's take as he put it in this one. Penicillin. Penicillin is a gram-positive and gram-negative bacteria. Also, it worked with chlamydia. Chlamydia is very hard gram-negative bacteria, very small, very tiny. Okay, now gram-positive and gram-negative bacteria. Imagine now when you are saying gram-positive, gram-negative, lipopolysaccharide, outer membrane protein, and then beta-lactam group, the cell wall is very thick in gram-positive bacteria. Aha, those ones you need to remember it now. Mycobacterium, it is almost on this one, and then cell wall is thick also, and then waxy structure, mycolic acid is exist. So when you are taking penicillin, it is going to help gram-negative, gram-positive bacteria, and then this one, but dominantly gram-positive bacteria. Vancomycin also, when we are going to have vancomycin, yes, mycobacterium, look now. So it is going to serve here for gram-positive bacteria, but it's not gram-negative bacteria, vancomycin. No, gram-negative bacteria only. Look now. So that is vancomycin. In cell wall, it plays role. Look at here. Very interesting. And when you are coming streptomycin, look at streptomycin is going to be treat mycobacterium and gram-positive bacteria. But the danger from streptomycin, it is going to harm your hearing. If you are continuously using streptomycin, you need to tell to your doctor to change it. You can lose your hearing. Streptomycin. What about tetracycline? Yes, if you are going to give children less than 2 years, it is going to make their teeth yellowish. So for this reason, you don't need to give for children tetracycline. If the doctor prescribe, no, say it no. Why? It is very important now. Look now. So if they are going to prescribe tetracycline, be careful. It harms also kidney, not only the teeth. Tetracycline. Okay, now there are isoniazid mycobacterium. Look, this is narrow spectrum. This is broad spectrum. And this tetracycline is more broad spectrum, except mycobacterium itself for all. You see, that's why we are saying broad spectrum and narrow spectrum antibiotic drugs. Haha, I was saying antibiotics. Now, here we finish. There are some sulfonamide group, and then these sulfonamide group are specific for metabolic reaction. Sulfonamides outcompete essential folic acid. Folic acid is ferric acid, that is iron. Iron is very important. And then if you are losing iron or the bacteria does not get iron, it will die. Mostly these sulfonamides are playing a role in DNA, RNA biosynthesis or synthesis or replication. Why? Look now, DNA is very important for what? For genetic information. RNA for protein synthesis. If two of them, they don't work, the bacteria cannot survive. You see how it is very beautiful? Sulfonamides are good. This is beta-lactam group, which you are going to say the penicillin treatment we use them, and then that means beta-lactam are the group of bacteria which are having very thick cell wall, very thick cell wall. And then when we are using penicillin break down the cell wall, and then bacteria cannot survive. Aha, that is how the drugs are working. For beta-lactam, we are going to use penicillin, and then vancomycin also we will use that vancomycin mostly for certain bacteria like staphylococcus, streptococcus area, staphylococcus mainly. Look at here. So penicillins are breaking the cell wall for gram-positive and gram-negative bacteria. Cell wall. You know it. So they interfere on cell wall synthesis, causing the cell to burst, explode. Beta-lactam group bacteria can be treated by penicillin because it is going to fractionate their cell wall. Very beautiful information. Look now. Here now, we are coming to end now. Bacteriologically, which we need to see, for example, when we are say antibiotics, look very interesting. Vancomycin, we said, look now, it is gram-positive bacteria, which are staphylococci, are going to be distracted or destroyed by vancomycin. And then it damage ears and kidneys. Aha, like a streptomycin. Look now. Certain drugs are not good. Look now. Here now, you are going to have, I need to increase a little bit, this one. Let me increase this one, like this. Look now. You are having, for example, certain protein synthesis blocking type of drugs, or we call here, it is saying antibiotics. Which antibiotics? Look now. Here, aminoglucoside, tetracycline, mycolides, clindamycin, streptogramin, those ones are going to inhibit the protein synthesis in the bacteria. So the protein synthesis is depending on RNA. So RNA cannot survive without protein, you see. So for this reason, you need to know it. So somebody is asking here, Joanna Martin is asking, when is the report lab must be reported? I think it is up to 10th of December. 10th of December. Joshua, Joanna, you need to know that one. Okay, now, so here you are coming nucleic acid sentences. For example, DNA, quinolones from malaria whatsoever, quinolones and rifampin for treating TB. These ones are going to damage RNA, you see. So those antibiotics which we are going to use, they are going to quinolones and rifampins are working with RNA and DNA. No genetic information, no protein synthesis. And then some of them are going to work with cell membrane. Cell membrane is going to be destroyed. Why cell membrane? Cell membrane is one of the structure of respiratory structure in bacteria. You see now. ATP production in bacteria is cell membrane, you see now. So it is going to damage. And then the bacteria to get air, it can't. So it cannot survive. That's why we are going to direct those antibiotics. And then folic acid is very important also. These sulfonamide groups are containing and then destroying those iron. And the bacteria to grow, it needs iron, you see. So that is how we are going to think the drugs are going to work in our body system. Look, very interesting, very. Please, if you are very interested, try to read chapter 24 on old one, or chapter 10 on the 11th edition. Read it. It will give you, when you are going to study about pathology whatsoever, or pharma dosage whatsoever you want to read and then understand it, go there and then find it, some information. It's very beautiful. Antifungal and then antiparasitic, two of them I will touch, the other one short. Look now. Several classes of antifungal drugs cause membrane damage. Yes, we are going to use, look at nystatin, amphotericin B, imidazole. They are going to damage the membrane of the fungus. So they break it down. So why is it important to take those medication? Most of the fungal medication we are using on ointment. Why? Because they damage the liver system. Yeah, amphotericin, nystatin, there are another ones also. They are going to damage your liver system. Fluctosine, grasoflavin, you see, those are going to damage inhibiting mitosis or cell division. This mitosis means the fungal, it may not pass its own cycle of mitotic, that we call it interphase, prophase, metaphase, anaphase, telophase. Stages are going to be distracted, or they are going to diminish because of grasoflavin, you see. So for this reason, we are using, look, caspofungin are for candidias and aspergillosis, aspergillosis niger, aspergillosis flavum, for those ones, and then fluctosine for candida, and then cryptococcosis. No, those all are against fungal origin, but the damage, you need to be very careful of fungal medications. You don't, when you take, you need to get rest and then take so much liquid. That's good enough on the fungal origin. We touched that one already on chapter 17 and 18 and 19. especially on 18. Okay, eukaryotic microorganism, the fungi. Okay, anthelmintic. What do you want from this one? There are parasequental, we say, change membrane permeability in cestode and trematode. This carbon tetrachloride, we call it CCl4, we said this parasequental is very important to kill cestode, tapeworms of dogs, which look like in dogs like rice type structures. They are cestode. Those are tapeworm, you see. So those ones, trematode for Fasciola hepatica, Fasciola gigantica, can be killed by parasequental. It attacks the animal, the cows also. You see, you know those are this solium and then beef one. Those tapeworms are going to be treated parasequental also. Membendazole, we call it measles also. Most people in third world countries, they are using this one for antibiotic as an antibiotic for certain bacterial origin too. So we call measles. And then inhibit, you see, it feed on the nervous system, membendazole. Also, when it is feeding on the nervous system, it is working with muscle. So it disrupts the muscle activity too in animals. Abromycin causes paralysis. This is paralysis coming. You see, it is going to touch the muscles of the worms. That's why it is coming with paralysis also. Abromycin. Those are going to be given injection in America. Okay, now, so antibiotics are available over the counter in third world country, including my country, but now it's stopped. Antibiotics used in widespread in livestock feeds. Yes, yeah, yeah, you can get it. I'm allergic to penicillin. If I eat meat, animal treated with penicillin, I'm going to be allergic. I have done it. I have seen it in America also. Food and Drug Administration in America, they don't allow feeding antibiotics or drugs for animals, really. They control, but their smugglers may use it anyhow. Anyhow, look now, our sisters also, when you are going to take birth control medications, those ones are having steroid and antibiotics too. Aha, certain poultry farms, they are using certain drugs also to do what? To control certain diseases, because chicks are very sensitive for parasitic and bacterial diseases, you see. So even certain viral also, you see. For this reason, people are giving them, you see. They give them a small dose. That is how it is going to be very dangerous. So our sisters, especially when you are taking birth control 5 to 6 years maybe, and then after that you need to stop and then take again after 3 months and then practice it. And then if you are going to be pregnant in the future, you need to stop taking those birth control medication at least 3 months before you become pregnant. 3 months. So that is very important to clean out those kind of stress from your body. If there is malfunction comes or something happens, you don't need to regret. You need to regret before. So those kind of things you need to read before even marriage, before you bringing babies. You need to read books about marriage, bringing babies also. It's very important, really. So here now, final one, viral drugs. Mostly we don't touch viral drugs, but I'm going to touch it here now. I took this one from Google around. It's not from your book. Look now, here now. Antiviral drugs are class of medication, yes. So we are not using for bacteria, we are going for certain viral origin. Okay now. So these antiviral drugs, they don't kill the virus. They are inhibiting, you see, inhibiting to enter into the cell, one. And then they are saying you cannot take your coat covering, you stay there with your capsid and with your envelope, stay there, don't move, they say. Okay. Thirdly, you don't touch RNA or DNA inside of that virus, or enzymatic actions or the proteinic structures, don't touch. It means inhibiting it. So for this reason, in viral medication, viral drugs never kill the virus. Never. They are inhibiting and they are blocking it. Okay. What does it look like, that one? Here now. I'm going to bring you now. Before entry, yes. effect on antiviral drugs before entry? Yes. During entry, inhibition of CD4, CCR5, and then uncoating inhibitors like amantadine, ramantadine, piliconaril, those ones are going to inhibit uncoating. You see, they say, no, you don't remove your coat, you stay there. Reverse transcription, that is desensitized nucleotides of RNA and DNA that they may not destruct or destroy. So that is zidovudine or AZT we call it. Protease inhibitors. They are going to send protease inhibitors that they don't synthesize, you see. So for this reason, when you are going to think, you need to think about the viruses when they are coming to multiply. They need to be absorbed, penetrate, uncoat, synthesis, assembly, and release from the host cell system. Those all are being blocked by antiviral drugs. Are they practical? They are trying. What is the most important drug which we use? We are using interferon. Interferon is the best one to treat fungal origin. You see, if you are bitten by a rabid dog or whatsoever, you are going to be treated by interferon. So interferon is like an antibiotic for viral origin, you see. So that is very important, and that is going to end, I believe, end my case now. So here now, what I'm going to give you now, information. One, really, lecture exam, I didn't prepare it yet. I didn't. I'm going to prepare it. How many? I don't know. I'm going to work tonight and tomorrow. Okay, now, here, I'm not going to take any true false questions. I think 316 questions, which I gave you only. I'm not going to bring any except those ones. So try to memorize them. Those ones, you can make it good. Okay, now. So the time when it start, I send you already to the announcement. Read the announcement when it is going to start. It is going to start like before, the same. So the exam is going to start at 6 o'clock, you see. So for the ones who are taking more time, there is more time given there because of certain conditions. And the other thing is, when you are going to submit the lab report, you need to report it up to, I think, December 10. I think December 10. The last day is December 10. So you are going to report it up to December 10 and then send it, post it on the discussion site, which I posted for you, the rubric. Follow the rubric when you are going to post it, you see. And then there are certain students, they say, can we send it on PDF? Yes, no problem. Can you send it by Word? Yes, you are welcome. No problem. I am going to accept it. But if you are going to send it by email, and then when you are going to send me by email in Canvas, I'm going to take so many points and then you don't get it. You don't get it. You need to post it on the site which I require it, and then follow the rubric which I send you. What is it missing? When you are posting it, see it first. What is missing before you send it? And then after that, you need to send. You see, I want the page as it is. You don't need to change your page. As it is, you need to leave it. So if you are going to change, then you are not going to get a good points. I'm telling you. So follow the instruction. You see, Brandy is asking me if the exam start at 6 p.m. or whatsoever. Exam. I send you this one, please. By the way, why don't you read your announcement? Read your announcement, which I send you. So that is very important. Before you come, just open it, glance it at what time you are going to take exam, when the exam is there. I posted already today. So you need to read, really. Not always wait from my mouth to hear it. You need to go around and then read. You see, follow the instruction which I send you. That's all what you need to do. And then the activity which you have done on video clips, I'm going to do it in these days. Up to Saturday, I will finish. And then I will send you also each segment video clip how many points it has. I'm going to post, and then I have already some students who have done very beautiful reporting. I will give you as a sample, I will send you, and then you will see it. If there is something you haven't done like that, I'm going to take so many points on that, really. I explain you. When you write, you need to write number, and then you need to say it 1, 2, 3, 4, 5. You need to write it. If you don't do those things, you didn't follow, I'm take some points from there. Yep. You need to follow instruction. Instruction will kill you and then save you. I said already before. So that is all. I'm not going to change anything on that. No, that is the leader saying that, yes, I said interferon. It is, we use antibiotics for bacterial, and then interferon, we use it for viral origin. It is not antibiotic. It is interferon. It is hyperimmune serum type. We can produce it in vivo and in vitro system, that one with viruses. So that is going to help only for viral origin, not bacterial origin. We never use for bacteria interferon. No. So if you are having certain question, please don't email on the other one. Even when you want your recommendation letters, don't. Hey, by the way, I don't know, it is the end of the semester for you guys. You know, there I heard today, they are saying that there is certain amount of money for the ones, for example, you lost your job, and the ones you are paying gas, and then you don't have gas money, and whatsoever, maybe you have a car, and then your car is pulled out because you couldn't pay it. Those kind of information, I think you can have some money. If this leftover money exists, so if they ask me, I will say you are my student. So try to go around and then contact student services, student department, and then ask information and then apply for it. Maybe they can give you some money. There is some money still, there is. So try it. If you lose, lose. If you get. You see, they can give you some money for that. So that is all what you need to do. Good luck, and then I will see you. Please, there is one thing which I need to tell you. You are leaving anyhow. This COVID-19 virus vaccine is going to start on December 11th, they say. So be ready on that. Be ready, really. There is some problems exist in that. So think about, please Google around. If you are interested, hey, there's no activity today. I told you that in the beginning. The students are asking me their activity. No activity. You need to go and read for your exams. So what you need to know is, you know, this vaccine is being made from Caucasian aborted baby lung. And then that is how the vaccine is being prepared. So they are saying 90% effective, and then some countries, China is saying 95%. Please see it. This vaccine we call MMR vaccine. MMR vaccine, how it is going to be applied. Google around and then see. Go YouTube and then see MMR vaccine against COVID. What is a side effect? What is going on? Please. Yeah, it is. They say it is a baby fetus or aborted baby, Caucasian lady aborted lung. Aborted lung is going to be a source to make a vaccine. So you need to see it. So I don't know how long that baby is, how long it is, I don't know. It says generally from Caucasian aborted baby lung, how it is going to be made. So try to Google around, see it, YouTube also, and then see it, how it is going to be. That's all. Thank you, and then see you again on the exam dates, or I'm going to post for you the hours, and then just go and then read those sites, really. So if you are having questions, just type me and send me on Canvas.